Hi, I'm Dr. Whitcomb, and welcome to our Talking Newsletter. Today's topic is understanding your fibromyalgia family member or friend. Before we get into that, I just want to mention a couple things. Number one, we have developed over the past couple months a new treatment for fibromyalgia that has really changed things significantly, and it's kind of come off of our new test that we've been using over the past few months. If you'd like to see that test in action, you can go to our website at stopfibro.com, and up towards the top we have a number of people being tested, and you can see some of the results. I think the results are absolutely amazing. In most cases, we can take half, sometimes all of a patient's symptoms away in just a few minutes, anxiety, pain, those type of things. And it's working extremely well. I'm extremely happy with that. And so that test has kind of evolved into a new treatment as well we're using in the office, which has also brought us to something that we've only been doing for the past 2 weeks, but we have a whole new system so that when the patient goes home, a family member can actually apply a lot of this new technology we've developed at home. So we're extremely happy about that. That will actually help our patients stay well in a higher percentage at home after the treatment. I do want to mention the seminars. We're going to be in Toronto, Canada, towards the end of this month. You'll be able to get that information off of our website as well, and also in the Talking Newsletter on the front we have that information. And then next month we're going to be in Austin, Texas and Houston, Texas. Also next month we're going to be in New Mexico. That's not on the website yet. I'll give you that information as soon as we have it available. I'd like to introduce a new doctor that we've added to our staff. His name is Dr. Bradley. We're happy about having such a talented doctor on staff. He'll be starting November 1st, and then January 1st we have Dr. Andrew will be starting with us. He is a psychiatrist, and he'll be on staff, and his services will be available as well. So I'd like to welcome those new team members. And also, for those of you who are calling in and talking to our patient care representatives, we have added a few more of those. We have 9 people available now to answer your phone calls and all of your questions. So let's get into our topic today. First of all, I'd like to address, why does your fibromyalgia family member, spouse, friend, whoever they may be, why do they act like they do? And I can tell you this, fibromyalgia comes from a pulling on the covering of the spinal cord that attaches to the nerve roots. All of the nerves of the body, including the cranial nerves, have to pass through this meninges. When it's pulled upon, it makes those nerves fire. If it sends symptoms to your face, or if it sends nerves to your face when you pull on that nerve, you're going to have pain in your face, or numbing, or tingling, or feel like somebody's crawling across your face when nothing's happening. If it goes to the rest of your body, you may have muscle spasms. You're going to have sensations of pain. You're going to have the sympathetic nervous system, which fires and turns on and doesn't turn off, and so you feel anxious all the time. This keeps you from sleeping at night. It keeps your digestion from working properly because it turns the parasympathetic off. It makes you extremely tired. It makes you depressed. It makes you irritable and grumpy. Not because you want it to be, but because you never get a day's rest. You never feel rested. You never get a good night's sleep. And so this is typical of most fibromyalgia patients, and it can be in any degree, from a very light case of fibromyalgia up to a very severe case where you start losing your ability to speak or to walk, and you end up in a wheelchair. So what I'm trying to say is, if you have a family member that's experiencing this, if you can only imagine a person who's always in pain, always exhausted. I'm not talking about tired like you missed a night's sleep. I'm talking about like you missed a week's sleep. You're always exhausted. You're in dire distress because of your intestinal system, and not only because of the pain and so forth, but the anxiety oftentimes gives you panic attacks. You just feel like you're losing your mind and going crazy all the time, and that can be to a mild degree or to a severe degree. But if your family member is suffering with this, I want you to know why they're feeling like they are. In addition, your hormones go off. Most women have no testosterone, or very little when they have fibromyalgia. Their estrogen can be off. They can be very, very moody and emotional and grumpy and tired and snappy. Same thing with the men. Their skin can hurt so bad that they can't even stand to be touched. So if you're trying to be married to a person like this and they don't want to be touched, and they're irritable, and they're tired, and they're grumpy, and they're in pain, sometimes they can barely walk, you can imagine what kind of stress it can place on a family. Or if you have a friend that has this is what they're going through. What I'm trying to get my point across here is this is what this family member is going through, and this is why they're going through. Now, what can you do about it? You can be a friend. When a person is hurting the worst, that's when they appreciate the friend the most. If you're a friend of a fibromyalgia patient, please don't ignore them. That's what everybody does because they don't know what to do with them, and they become so alone. Don't take them to dinner. Don't take them out someplace. Stop by and have a quiet time with them. Bring them a present. Bring them something nice to eat. You know, bring them a big hug and let them know you care about them, and just spend a little quiet time. Don't try to get them to do anything because most of them don't feel like doing anything, and so they almost don't like people visiting because people want them to do things they can't. So stop by, encourage them, give them a good hug and let them know you care, and do it regularly. And if you get a chance, pick up the phone every day and just say, "Hi, how you doing? Are you okay? Is there anything I can do to help you?" Because they really suffer, and oftentimes they feel hopeless for two different reasons. Number one, because they don't know they can get help. And number two, because it gives you feelings of hopelessness and despair. So if you have a friend or family member like this, please just love them. Spend that extra time with them. Don't get them to go do anything, or don't let them entertain you, because they really can't do that. And if you're the fibromyalgia patient yourself and you have a family member that you would like to understand you better, have them watch this short little video. It's real short. If you want more information, at our website, stopfibro.com, we have about 5, 6, 7 hours worth of videos, just everything you could possibly want. We have a whole in-depth talk on fibromyalgia and all the different aspects and how it affects so many different things. Your family members need to watch this as well as you, and you'll understand more about why you have fibromyalgia, why you feel like you do, and so will they. Anyway, thank you so much for listening to our Talking Newsletter. Hopefully I'll see you in Toronto or maybe in Texas next month. We're also, like I say, going to be in New Mexico, and in December we're going to be in Sacramento. So anyway, if you can't make it to one of those, please give our office a call at 530-543-1800, and one of our representatives will help you. The information is also on the front of this newsletter. See you next month.